starting off with what is sensory integration, I would say that question has changed over the years. It's really a huge question that's quite complex. So the easy answer is that sensory integration is a theory that was developed a really long time ago by an occupational therapist named A. Jean Ayers. And she was looking at the dynamic neurological development of the human body, as well as the kinds of things that might go off and the strategies and techniques that we can utilize to help people who are struggling with sensory integration. So it's hypothesized to be a normal function of the nervous system. So when people say, oh, Jennifer, look at that boy, he has sensory integration, I'm going to say, yeah, so do you. So as a theory, it's been kind of a controversial theory. And so at the time that Dr. Ayers was alive, everybody went to Dr. Ayers. And after she passed away, things began to change, in particular, the new neuroscience technology that allowed us to see inside the living brain. And so at that time, people from other disciplines, other than occupational therapy, began to say, what is this sensory integration stuff? And so the language began to change. And so now we say sensory processing because it's more clear as to what the process in the nervous system really is. And so now we might say that a person is having a sensory processing challenge or problem or disorder, and that the treatment is based on the theory of sensory integration. So one more thing about what is sensory integration. Sensory integration is the neurological process that organizes information from the environment as well as from the body and helps the body effectively perform within that environment. So that would be the definition of typical sensory processing. So when we think about sensory profiles, when I use that language, I think of Dr. Winnie Dunn. And Dr. Dunn has organized sensory profiles into 4 quadrants. So if we think about a neurological continuum, a neurological thresholds continuum, it can go from high to low. And then Dr. Dunn has hypothesized this behavioral response continuum as well, going from active, where I'm trying to do something differently to make my threshold change, all the way over to passive, where I'm kind of just behaving the way I was made, just behaving the way I came into this world. And so if I have a very high threshold, it takes a lot of information to activate my nervous system. If I have a really low threshold, doesn't take very much, everything sets me off. So if I have a high threshold and I just passively respond to my high threshold, I'm kind of like, I have this low registration. I miss things. I may not hear someone call my name, or I may not recognize I have food still on my face. If I have a high threshold, but I actively try to change that threshold, I may go out sensory seeking. I need more information to feel okay. I need more information to know where I'm at in space or how my body is sitting in this chair. If I have a very low threshold, and I'm acting just the way I came into this world, very passively, then that low threshold would be I'm very sensory sensitive. Everything sets me off. For example, I'm in this beautiful setting, but I'm trying very hard to modulate the wind and the sun and the bugs and the boats, and really everything just was activating my nervous system. So that would be someone with a lower threshold passively responding. And then finally, a low threshold actively responding is I'm going to try to sensory avoid. I'm going to try to stay away. And that might be that child who doesn't come to the circle, needs to sit outside the circle. They can't tolerate the amount of sensory input coming in their little bodies. So they kind of put themselves off to the side. They still know the songs, they still know the answers to the questions, but they just can't fully be right there in that moment. So the red flags of sensory processing disorder are many, and sometimes people don't recognize them because they just kind of excuse them. Oh, he's very active. What a cute little boy, but boy, I wish he'd slow down. So being excessively active, or the other end of the spectrum, not being active enough for their age. Being overly sensitive to any one of the sensory systems, sight, sound, smell, touch, taste, movement. They don't like to go on the swing set at the park. They might want to lay on their tummy instead. They don't like their hands to be dirty. Kids who have difficulty paying attention, we might think of that as being attention deficit disorder or attention deficit hyperactive disorder, but we know kids with that diagnosis have a big chunk of their profile to be a sensory processing difference. So anything that's excessive or lacking, I would say, in any one of the sensory areas would probably be worthy of at least getting an occupational therapy opinion, just to see if there might be something we can do. So attention behavior, seeming to be willful, seeming to be mischievous, touching too many things, not being willing to try things. The list goes on. And so the characteristics of sensory processing disorder are very easy to attribute to bad behavior or to other things. Movement is a sensory system. And so it's not just the basic 5 senses that I think most teachers learn, but that movement is also one of the sensory systems and a really powerful system to help children calm and to organize and to sometimes get out all those fidgets that before they come and focus and do something a little more academically challenging. I actually have one teacher that had so many kids in her class that were so rambunctious when they first arrived that she would greet them at the door and there was a mat between the hallway and her door, and they would actually somersault into the classroom. I had another teacher who had kids stand on their chair and jump off, and while they jumped off the chair, before they landed, they had to spell their name. So people can incorporate all kinds of things that are movement related, sensory related at various times throughout the day. Just like I have to eat breakfast, lunch, and dinner, I have to have this sensory input, I have to have this sensory input throughout my day to help me stay regulated and organized and ready to take on the next challenge.
In an early childhood classroom, I think it's important to set up an environment that allows all students to engage in different types of sensory activities. To do that, it's really thinking beyond just the sensory table. That's an obvious one, and of course we put lots of different items in there for the students to explore. Water, sand, cotton balls, snow, all different types of things. But I also like to put a lot of items in the science area. So I do what I call mini sensory bins. So I'll put different items in there with lots of different textures. And it's a great way to not only give different sensory experiences, but also expand on children's vocabulary. We also always have one that's a nature-like item. So pine cones or grass clippings, so that we can talk about the environment and things that they touch and feel each and every day. Some of the other things that we do are include a lot of different exercises and things that they're doing with their body to explore how their body works. We always have a little motion that they do when they come in as part of their entrance routine. This week they're trying to stand on one foot and use their hands to balance and trying to balance for a whole count of 5. They really like doing that. And during music, we also do what we call yoga stretches. We include those with input from the physical therapist that works in my room. She kind of lets me know how to get the children properly into those positions, and then we practice them each and every week as part of our dancing time. And the kids really enjoy kind of exploring how their body works that way. So I think those are just some of the ways that we include it, but even things as small as the baby blankets in the kitchen area. I have one that's silky, one that's made of fleece. It just allows for different experiences all throughout the day, and it's a great conversation starter.
First of all, we look universally at the classroom. What types of things are going on in the classroom? Is it a very busy environment? Can we do simple things like dim the lights? Can we provide a different way for that child to work in the classroom, maybe just with one student instead of a whole group of students? We can look to see, what does their overall posture look like? Do they need a special chair to sit in so that they can sit upright better to play with the toys and materials? When they're at circle time, could they benefit from something that would give them a little bit of deep pressure so that they could feel grounded and organized and be able to participate? Maybe they need something where they can actually move while the teacher is talking or reading a story. So we can do something simple like a move and sit cushion, so they can move around and then still be able to actively participate without feeling like their body needs to get up actually and move out of the circle time.
The ways in which classroom teachers can provide children with appropriate sensory experiences is an interesting concept. An appropriate sensory experience really needs to be delivered in the context of each and every child's individual sensory profile. So, for example, if this child does not like touching things, I wouldn't take their precious little hands and shove them in the finger paint, thinking that if they just touch it, they'll be okay. So it has a lot to do with respecting individual differences, emotionally supporting the children, providing the activities. And for some kids, it might be just enough to watch. It might be enough to carry the materials to the table, but not everyone's going to want to get involved at the same level as their colleagues. So the individualizing is really important when it comes to sensory processing. The sensory diet is really everything we do throughout the day. And so if we stop and pause and think about ourselves, I like to use a lot of self-reflection when I work with teachers and parents. So if I think about my day and how I respond to getting up in the morning and what do I do first and how do I calm myself down when I'm getting nervous about something, or how do I get myself revved up to go out and do something, the things that I do are actually part of my sensory diet. And so when we utilize the language sensory diet for kids who have sensory processing differences, it's just a little more formalized.
We also can provide some more targeted interventions, like if the child feels like they're getting more disorganized, or we know that certain times of the day are more difficult for that child, we can build in some what we would call like a sensory diet, a sensory break. So we might take that child and move them in the hallway. We might push a big ball. They might do a job like pushing the chairs in when table time is over or snack time is over. They might walk to get milk, either carrying a heavy cart, pushing a heavy cart or carrying a heavy basket. They might be the one that puts the library books away. We might work with them with another child in the hallway pushing a big ball or moving back and forth. Or maybe we just, overall, the whole class is just going to jump and move and do just like a little movement break, because that's good for that little child, but it's good for everybody too.
There's many benefits to having the occupational therapists come into the classroom. One, they provide supports globally to all of our children. So they come in and give the teachers ideas on different activities we could do involving fine motor skills, sensory regulation. And then on kind of a more focused area, they work with individual children and give us specific ideas to help make them successful, regulate their emotions, regulate their sensory system, so they're ready to learn in the classroom.
It's a good opportunity too, you can like facilitate interactions with the other students, because that's what they're here for, to learn and be with the other kids.
So when teachers have concerns for some of the kids in their class that they might be presenting with sensory processing differences, I think there's a lot that teachers can do in the context of their classroom. Sometimes having just arm rests on a chair by the desk for the child so they feel more proximally secure. Sometimes having a little something under their feet so that their feet are touching that so they don't slide out of their chair. They can do things like having something under the desk that the child can feel. Sometimes we'll put sticky Velcro so the child has something to do, or a fidget toy. I'm really big if the child can manage gum. I know it's kind of blasphemy in education, but if kids can chew gum, it's a really nice strategy as well. So the type of seating that the children have, allowing them to maybe wear a visor or even sunglasses in a classroom might be helpful. The list goes on and on. There's a lot of modifications that teachers can do if they're willing, that will help young children focus, relate better, and to learn. Of course, at the other side of this, there are also other people that they can call in, like registered occupational therapists, who can come in, observe, consult, maybe fill out an OT, sensory processing, a checklist of some sort, or do an evaluation, and then make recommendations to that teacher how they can work together to support that child's sensory processing differences.
The benefits of pushing into the classroom and working with the teacher is so important, because what we do in the classroom is not only beneficial to the kids, but we need for the teachers and the assistants to carry it over. So we go in there maybe once a week, but the most important thing is for what we do to be carried out throughout the whole week. So that's why it's so important to be in the classroom working with the teachers and teaching them how to implement an accommodation, how to adjust something for a child to make it easier for them to learn.
For the team meetings, we have one for each classroom, because I'm in a couple different classrooms here, and it'll usually be all of the service providers, so occupational therapy, physical therapy, speech therapy, social work, and then the teachers and the paraprofessionals, and we all meet, and we kind of just go through the list of students we have and talk about how they're doing, celebrations. We always like to start with positives, and then kind of if there's something we're working on with the student that we'd like everyone to know about. So sometimes that would be the time I'd bring up, like, oh, I'm thinking of trialing like a weighted vest with this student. I've noticed whatever XYZ is going on, and I think maybe that would help them. And then the team can give their input and kind of give you some examples and see if maybe they've noticed the same thing.
During those times when we focus on one particular student, it gives us the opportunity as a team to really drill down into what that student needs to progress toward a specific skill. And I think one of the ways that we're able to do that then is to really stair step how that student can get there so that they're successful all along the way. That ending goal in their individualized educational plan might be lofty, but during that team collaboration time, we can really talk about as a team the tiny steps that we can take to get our students there. And what's really nice is sometimes as a classroom teacher, you get maybe bogged down by the day-to-day, and by having that collaboration time, those physical therapists, occupational therapists, school psychologists can offer a perspective that we might not see because we're in it so entrenched. And because they're a little bit more peripheral, they can offer us suggestions, ideas, ways that we can embed and incorporate those skills in a really natural way so that not just that individual student is making progress, but all the students are making progress.
The ways families can support kids at home who have sensory processing differences are almost exactly the same kinds of things that teachers can do, only more. They can think about, do they need their child to calm down? And if so, they can use strategies like taking a bath versus taking a shower at night, if they're nighttime, bath time shower people. They can think about allowing them to stand for meals instead of sitting in a chair where they rock back and forth. They can do things like, I have a person that I know very well who hung a platform swing in their basement so the child could get a lot of vestibular input, even if the weather outside was not letting them go out and swing. So the modifications that families can make really should be embedded into their routines and their family rituals. So fidget toys that are in the car, alternatives to sitting at the dinner table, allowing them to wear certain kinds of clothes, socks inside out. It really, the sky's the limit once parents open their minds to what their children's needs are.
One of the biggest elements of our program here at Valley View is we work with the families in the school and at home. We make an effort to do home visits with every child, where that's a time when we can really collaborate with the family to see what their needs are at home as well as at school, because sometimes what we see as far as sensory needs at school is different than what we see at home. And sometimes we get really good insight from parents, things that we haven't noticed before, or new strategies to try with the child. I can think of one recently. We had a child who had a hard time sitting still at circle time, and because of a home visit, we found out they had a little squishy toy that they really liked, and mom and dad started sending that specific squishy toy, and he was able to keep his hands busy and regulate his sensory system that way. And that's a strategy that we've tried before, but not with his specific toy, so it helped us kind of connect with him and and figure out, new strategies to try with the kids.
One way that we work with parents is their input that they give us. Some parents may let us know that either a child might be wearing a specific either sweater for a reason, that's something that they like. So then we try to work with them in understanding that, boundaries and what we can either push the kid to do or not do. When the parents come in to volunteer, they work with our occupational therapist and our physical therapist to see kind of what they do here. And our parents come in sometimes and they give us suggestions on how to work with their child, and we always take that in just because they're with them majority of the time. But then our physical therapist might use that information and then kind of work with what they've given us, the parents have given us, and kind of just add a little bit more of a task for them to do here at school. So a lot of input is given by the parents. Throughout the year, we always check in, whether it's parent-teacher conferences or even emails, letters sent home, any way we can communicate with the parents. It's very important to get their input on their child.
When we try to communicate with families about sensory integration, it typically does come about when someone is concerned about something regarding their child. So obviously, if we're utilizing a relationship-based approach, we really want to be sensitive, and we really want to help them understand that what we're telling them about their child is not a criticism, it's not made up. I think one of the important things to help parents understand, it's nothing they did, it's just who their child is. As an individual neurological creature, it's who they are. And that by understanding this, it'll improve their relationship. Hopefully it'll improve their home life. And of course, if we're talking with teachers or caregivers, it might also help the child have a more successful experience making friends and learning. Why is it important for families and for parents and for teachers and caregivers and people to understand sensory processing? I would tell you it's because it gives them another tool for their toolbox. It gives them another key for their key ring. When we're looking at children with new eyes, and that's something the phrase I use a lot when I talk about sensory processing, it helps us to understand that all behavior has meaning. And it's our job as caregiver, parent, teacher, as our job as adult to figure what that behavior is telling me. And so having the understanding of sensory processing, that little children, big children, human beings, our life partners, our teaching partners, everyone has their own sensory profile. And sometimes it'll make a difference in terms of the way they behave, the way they talk, the way they're available for relationships and learning. And so understanding sensory processing gives us a deeper understanding of human behavior and relationships.